NHS and social care services should be available to everyone who needs them and when they need them. But there are people, perhaps more than you imagine, who are disabled, deaf, or for whom English is not their first language, who will have additional communication and information needs. We need to make sure that these needs are met so that everyone gets the best from our services. And that's why the Accessible Information Standard has been introduced for all NHS and social care services. The aim of the standard is to make sure that adults can access the health and social care services they need and have the information in a format that means they can make their own decisions about their treatment. The Accessible Information Standard has 5 basic steps. Ask what communication or information needs a person has. Record those needs. Clearly flag them so that other professionals will see and follow them. Share the information with other professionals when consent has been given. And act so that people can have the information in the format that suits their needs and appropriate arrangements can be made for appointments. Patients may already have a written record of their basic information needs. Always be sure to ask if they do and if they can bring that with them. Having the basic information needs available will enable you to arrange for any additional support required and to prepare information in the most appropriate format. It's important to follow the Accessible Information Standard so that we don't make assumptions about someone's information and access needs. When we get things right for people, it makes a big difference to their care. For example,
the doctor made sure that we sat in the same place for all our appointments. My husband could see the interpreter and there was a good light in the room so that I could lip read.
I was asked the best way to contact me, and this meant that I got a phone call and was able to arrange an earlier appointment, which was great. I'm visually impaired, and if I had been sent a letter, I would not have been able to see it.
When we don't get things right for people, they don't feel valued. For example,
I get really good care, but when I don't have an interpreter, I feel like a second-class citizen. I want to make the decisions about my own health and care.
Some places say I can't have an interpreter because I lip read. They don't understand how tiring lip reading is. When I am ill or anxious, I can't manage, but I do need a BSL interpreter. Making assumptions about a person's ability to communicate and their information needs can cause real distress for them, their family, friends or carers. When someone's communication and information needs are not met, their experience of health and social care is poorer and they can have worse health outcomes. Make sure you always ask if someone has communication or information needs related to a disability. There won't always be an obvious sign, such as a guide dog, white stick or hearing aid, to indicate someone has additional needs. If they do have additional needs, ask the best way to meet them. For example, offer information in different formats, like large print and braille, or book an interpreter. Did you know that British Sign Language is a different language to English, just like French or German is? People with a learning disability on the autism spectrum or who have a mental health condition might feel anxious about visiting hospitals or find it difficult to stick to appointment times. The Accessible Information Standard asks that we make reasonable adjustments, such as offering a quiet waiting area or making someone first on the appointment list. Remember, as well as asking, recording and flagging a person's needs, it's important that we act to meet those needs too. For example, we should not ask a son, daughter or other family member to interpret confidential information. Be clear about who is responsible for booking interpreters. That's why it's important that you follow the Accessible Information Standard. This is a new process that will help you to provide a better service for people with additional communication and information needs. There is guidance available from NHS England on the web and training will be provided locally. And we want you to learn from your experience of using the Accessible Information Standard so that we can continue to improve it and together provide the highest quality services for everyone.